time, it became increasingly clear to me, it has become increasingly clear that we're dealing with a life. I mean, it's amazing to me the intellectual gyrations and dishonesty we go through to claim it isn't a life. I mean, you've got the 4D ultrasound, you all are far more advanced than I am on these issues. And so you're well aware. We've had studies about babies in utero feeling pain and responding to touch at early level. Of course, there's all kinds of counter research saying they don't. Just the fact that they would even engage in research to prove that a baby doesn't feel pain is amazing to me. That's evil that you would even be motivated to prove that a baby doesn't feel pain. You know it does at a certain point. But that's not even the point either. But it accentuates and emphasizes and illustrates that we're talking about a human being, no matter at what stage it happens. You know, legal abortions are not as safe as advertised. The pro-abortionist lobby will conceal that. They will conceal that there is some link with breast cancer. Now, I know when I wrote a column evidencing or documenting the research that there is a connection between abortions and breast cancer, I was seized on by the pro-death culture and by the secular left and saying what a fraud I was, a media man. Well, I don't know. I mean, I took a second look and then I found some more research. At the very least, it's debatable. So anything else, what about secondhand smoke? That's debatable. What do these Nazis do about that? And so there's some connection. They want to suppress the research about the connection between abortion and breast cancer. Why? Because they have an agenda. They're not interested. There's no intellectual curiosity. In fact, there's intellectual suppression. And you know that. So I can't prove there is a connection. But I know a lot of people believe there is, and there have been some studies that say there is. But I don't want to state more than the facts allow. I don't know. I just know that there have been studies that show there is, and these are suppressed. And you know darn well the women that are going in to seek advice and counseling about an abortion aren't told about any such risk. Nor are they told about psychological and emotional problems. An American Journal of Psychiatry reported a study of 500 post-abortive women. 43% showed immediate negative responses, and the number grew to 50% in a later review. 10% developed serious psychiatric complications. One psychiatrist noted, and I grant this is anecdotal, that he had an expansive practice. Since abortion was legalized, I've seen hundreds of patients who have had the operation. Approximately 10% expressed little or no concern. 10%, little or no concern. Among the other 90%, there were all shades of distress, anxiety, heartache, and remorse. Listen to that. Now, you think this guy's lying? Okay. Now, more recently, Dr. Priscilla Coleman, professor of human development and family studies at Bowling Green State University, part of a group of researchers that in 2008 published nearly 50 peer-reviewed articles indicating abortion is associated with negative psychological outcomes. Now, this group of people did all kinds of research. So this was an anecdote. And the results are less startling, but they are significant. She said she and 6 colleagues sent a petition letter to the American Psychological Association criticizing the methods and conclusions described in their task force report on abortion and mental health because she says it ignores, quote, the tidal wave of sound published data on the emotional consequences of abortion. This evidence, says Dr. Coleman, is accumulating despite socio-political agendas. This is not David Limbaugh talking, I wish it were. To keep the truth from the academic journals and ultimately from women to ensure that this big business of abortion, big business of embryonic stem cell, you see the analogies. This big business of abortion continues unimpeded. Coleman said, you see, because if we promote adult stem cell, what happens to the money per embryonic? It's all connected. This is of a piece. And I'm not stretching to say that. Coleman says a conservative estimate from the best available data is that 20 to 30% of women who undergo an abortion will experience serious and or prolonged negative consequences. 20 or 30%. And this is a conservative estimate. This is not the 90% that the psychiatrist anecdotally reported, but he wasn't reporting it to have some broad-based study. 20 to 30% in a wide grouping of studies. And this is a direct quote from her, any interpretation of the available research that does not acknowledge the strong evidence now available in the professional literature represents a conscious choice, listen to her, represents a conscious choice to ignore basic principles of scientific integrity. And they call us science averse. The human fallout to such a choice by the APA and like-minded colleagues is misinformed professionals because you're not giving them the data. They can't possibly be informed. Millions of women struggling in isolation to make sense of a past abortion because nobody told them it's normal to have these issues, so they don't know that they can go to a psychiatrist because they're having some condition that's relatively common for what they've gone through. Continuing with the quote, I can't help it, editorialize this one. Thousands who will seek an abortion today without the benefit of known risks, see, they're not aware of the risks, and millions who will make this often life-altering decision tomorrow without the basic right of informed consent, which is routinely extended for all other elective surgeries in the United States. But you see, these other surgeries, there are no opponents of these other surgeries, and they certainly don't have a politically driven lobby which has a strong, inflexible agenda and powerful agenda. But pro-life, the pro-life movement, which is intrinsically good, has evil opposing it. So the more obvious it's a lie, in my view, and in my experience and in my studies, the more entrenched become the pro-abortionists. They're defending the right to end innocent life and can't afford for any of us to view what we're killing as an actual human being. However, I've also found disturbingly that the more we discover empirically, scientifically, that it is in fact a human life, they are more entrenched they get, and now the more willing they are to say, yeah, some of them are willing to say, this is a life, we need to kill it anyway. We're willing to kill it anyway. That is chilling, folks. And it's going on. And don't think I'm exaggerating. It's the mindset. At one point, most medical texts, I understand, and pro-choice doctors even, before all this got politicized, and I don't know what the literature said, but at one point, most medical texts and pro-choice doctors agreed with one prominent pro-choice geneticist who wrote, the basic fact is simple. Life begins not at birth, but at conception. The beginning of human life is not a religious, moral, or philosophical issue. It is a scientific and biological one. Now, she's writing from this perspective. From the time those 23 chromosomes become 46 onward, the unborn is a living, developing individual with a unique genetic makeup. Indeed, from the moment of conception, the mother is carrying a genetically distinct human being in her womb. And we all know that. Now, some abortionists even acknowledge they're destroying human life, as I said. Let me quote a few of them. One physician who runs an abortion clinic, Metropolitan Medical Service in Milwaukee, Wisconsin, said, we know it is killing, but the states permit killing under certain circumstances. Think about that callousness. In other words, back to, I heard someone at our table talk about the spirit of the law, the letter of the law. Because you're technically obeying the letter of the law, you can assuage your guilt for committing terribly immoral acts and hide behind that. Another at the Boulder Abortion Clinic in Boulder, Colorado said, there is no possibility of denial of an act of destruction by the operator. It is before one's eyes. The sensations of dismemberment flow through the forceps like an electric current. An abortion in a New York City hospital said, even now, I feel a little peculiar about it because as a physician, I'm trained to conserve life, and here I am destroying life. Why? This is a pro-choice person talking. And another one, and the executive director of the National Coalition of Abortion Providers said, women enter abortion clinics to kill their fetuses. It is a form of killing. You're ending a life. 4 quotes from abortion practitioners. So, apart from what one of these ladies I quoted said from a scientific perspective, abortion is a moral issue. If it's just a harmless medical procedure, why do pro-aborts dare to call its name? Why do even pro-choicers say they want to make it safe, legal, and rare? If it's an unviable tissue mass, why would they want to make it rare? I just don't even understand the logic. And why don't they call it? It's absolutely absurd. It's an indefensible position to say you want to make something. Do we want to make extraction of cancerous kidneys rare? I don't get it. If the tissue is bothering the sacred mother who has complete sovereignty over her body, and there's nothing in there but a tissue mass, of course it's offensive to say that we want to make it rare. Why would you want to make it rare? It inconveniences the mother. If it's a tissue mass, get it out of there. As long as you don't mind the risk of elective surgery. Don't tell me you want to make it safe, legal, and rare. If you don't believe, it's a lie. It's just the dog won't hunt. It doesn't work. It doesn't pass muster. It doesn't pass the lab test. So they say, and others, why would others say, and so many politicians, I'm against it personally, but I don't want the law to impose my will on other people. Well, why not? What if we said that about murder for people who've already been born? I'm against murder, but there's some people in the world, probably in world history, that believe that homicide is a good thing. So why would I want to impose it? I'm against pedophilia, but I don't want to impose my will. Why do we allow that kind of nonsense to get in the public discourse and treat it seriously? Every law is based on morality.